A very good evening, ladies and gentlemen, from the city of Gqeberha. We are very privileged and honored to have you join us this evening in the lounges of our homes, where we are having conversations about vaccines. Yes, we all know COVID has been with us for a very long time. But finally, the vaccine has arrived. So it's been a week since the first batch of the long-awaited COVID-19 vaccine has arrived in the Bay. And we've had a host of frontline workers who have actually taken the vaccine already, been for their first jab, and I think everybody is waiting in anticipation and curiosity to hear just exactly what this is all about. After we've been enduring 2 devastating waves of the coronavirus pandemic, which have claimed the lives of thousands of people, including many frontline healthcare workers, the vaccine has become a beacon of hope for many. And for others, probably a little bit of a cloud of uncertainty. And we hope that tonight we can shed a little bit of light on your uncertainty. So as part of the vaccine rollout in the Bay, the Nelson Mandela University and the Department of Health in the Metro has joined hands to bring to you this educational campaign and to share some of the experiences, highlight some of the risks, if there are any, and also provide some insights in the processes of what you can expect when you go for this jab. So we look forward to hearing from the many different people that are participating tonight. This marks the first of a series of Vax Fax, as we like to call it at the university. We will have a number of conversations in going forward. We all know that as Mandela University, we anchor our engagement in the institutional values, and tonight specifically in that of Ubuntu. Our university prides itself in our engagement with the larger community that we serve, allowing us not to only listen and understand the needs, but also to allow people to co-create with us. So I really invite you to co-create in this session this evening. What has been really, really good throughout the pandemic, with every bad thing, there's some good things that come, is that we have had so many partnerships that have developed through the COVID-19 pandemic. And specifically, I need to acknowledge the Department of Health at district, provincial, and even national level, and the Office of the Premier, who has partnered with the university and walked the talk with the university in gaining better information, traction, sharing ideas with members of our constituency, of our communities that we serve. Of course, the one thing that has become really prevalent in our lives is that of digital technologies. And in my own life, in my own position within the university, I'm very privileged to lead some of these digital innovations together with our ICT services department of the university under the capable leadership of our CIO, who is making groundbreaking strides in this space. So we invite you tonight into the lounge for our vaccine conversation. We want to remind you that this conversation is aimed at you, the public out there, who would like to have some questions answered. You are our guests in the lounge today. My co-host this evening is Dr. Aneshri Thaver, who is also a member of the Metro coordinating team. And I would like to invite her to make a few opening remarks and then to introduce some of our guests in the lounge. So, Aneshri, over to you.
Good evening, everybody. Thank you, Prof. for that lovely introduction. And thank you for Nelson Mandela University for partnering with the Department of Health to bring together such an important conversation. I think that there are many questions that people have, and a lot has happened in the past 2 weeks. And the aim of these discussions is to provide scientific evidence so that people can understand what is going on in Nelson Mandela Bay and to better understand how to prepare themselves and to also put some of their questions to bed. So to assist us in achieving that goal this evening, we are joined by a very amazing group of panelists who it is my honor to introduce this evening. And I would like to start with our guests from Nelson Mandela Bay University. So this evening we're joined by the Nelson Mandela University's Deputy Vice Chancellor, Dr. Thandi Mgwebi, who has a PhD in medical cell and developmental biology. And she will be explaining to us how vaccines are working in, sorry, just one second. She will be explaining to us the science behind how vaccines work. And then from the Department of Health, we're joined by Department of Health's Livingston Hospital's Dr. John Black, who is an infectious disease specialist and who has been the clinical lead in the management of the COVID-19 efforts in Nelson Mandela Bay. He will provide us with a brief background to what has been happening with COVID-19 in Nelson Mandela Bay. Further, we are joined by Mrs. Timbisa Noche, who is the matron from the Department of Health Livingston Hospital, and she's been pivotal in the vaccine rollout, and she's going to take us through what has been the journey to getting the vaccine to Livingston Hospital and what are the processes that we have to follow in order to administer the vaccines in Nelson Mandela Bay. And finally, we're joined by a frontline hospital staff member, Mr. Matukolo Pati, who is a nurse at Livingston Hospital, and he's been fortunate to be one of the first group of healthcare workers to receive the vaccine. And he's been invited this evening to share with us his experiences of what it was like to be part of the group that received the vaccine. So this evening, we hope that you will join us in this conversation and enjoy what we have to share. On that note, I'd like to hand over to Dr. Mgwebi, and we look forward to hearing your interaction with us. Thanks.
Thank you very much, and thank you for the lovely introduction. I'm really looking forward to the conversation with our partners out there listening to us from their own lounges. My job is just going to take 5 minutes explaining how vaccines work. Of course, I'm trying to explain this in a plain way that can be understandable and not using the scientific jargon that confuses people. So before I can even start explaining how vaccines work, I think it's important that we understand a little bit about the body's defense against infection. Firstly, vaccines prevent diseases that can be dangerous or they can be deadly. And they reduce the risk of infection by working with the body's natural response to an infection. So to understand how it works, it will help to just look at how the body fights illness. So when germs such as bacteria or viruses enter the body, they attack and they multiply inside our bodies. And this is what is called infection, and this is what causes illness. So the natural immune system of the body uses several methods and tools to fight that infection. In the blood, there's red blood cells for carrying oxygen to the tissues and the organs, and white, or what we call immune cells, for fighting infection. So these white cells consist of many different types. And I'm just going to mention the 3 main types of white cells. The macrophages. These are white blood cells that will swallow up and eat up the germs, plus the dead or the dying cells. But then when they do that, they leave behind part of the invading germs. called antigens. So you hear a lot about antigens and antigen presenting cells. Then the body will identify these antigens as dangerous, and then they will stimulate antibodies so that they can attack them. And then we've got other types, the B lymphocytes. These are the ones that defend. They're the defensive white blood cells. They produce the antibodies to attack the antigens that I spoke about. And then we have the T lymphocytes. And these are another type of white blood cells. They attack cells in the body that have already been infected. So the first time the body encounters a foreign germ or a foreign substance, it can take a number of days to make and use all the mechanisms for fighting needed to get over the infection. So after the infection, the immune system will then remember what it has learned about how to protect the body against that particular disease. So the body keeps a few of the T lymphocytes, or the called memory cells, that go into action quickly after the body encounters the same germ again. So the cells will remember this because they've already dealt with it before. So how do vaccines work? Vaccines help develop immunity, or the immune system, by imitating an infection. So they imitate how a natural infection would have happened. So, but sometimes this type of infection, which is imitated, in fact, it never causes illness, but it does cause the immune cells to produce T lymphocytes I spoke about, T lymphocyte and antibodies. Sometimes after getting a vaccine, the imitation infection can cause minor symptoms, such as you can have fever, or you can have different symptoms that imitate the natural infection. Once the imitation infection goes away, the body is left with a supply of the memory cells I spoke about, the ones that will remember how to fight that disease in the future. But it can take a few weeks or so for the body to produce these T lymphocytes and B lymphocytes after vaccination. So it's important to remember this, because after receiving your jab, it doesn't mean that you are immediately protected. And there are different types of vaccines that scientists make. They use many different approaches. And these approaches are dependent on the information about the infection, whether the vaccine will be preventative, and it also about how the germ itself or the virus itself get into the cells of the body. The different types I can talk about, there's live vaccines where that fights viruses and bacteria, where there's a version of the living virus or bacteria that has been weakened in some way so that it stimulates an immune response in your body. But there's also inactivated vaccines also to fight the viruses and bacteria. But the one that we have now with the COVID-19 is called, it's using another type of a virus that's called an adenovirus. This won't cause the virus inside to replicate, or the adenovirus will not multiply inside your body. So it's not meant to cause disease. Rather, it's meant to stimulate your immune system so that you can build your memory cells, so that in the future, when you get infected by the same virus, your immune system can remember. Some viruses require more than one dose. You've heard about the Pfizer vaccine, and we've got now we've got the Johnson & Johnson vaccine, and this one requires just one dose. It's just easier for one dose, especially during the time of a pandemic. So we're very fortunate to even have a vaccine that's administered in one dose. So vaccines, like any other medication, they can cause side effects. But the most common side effects of vaccines are very, very mild. Many vaccine preventable disease symptoms, however, can be serious. or even deadly. But that's good to know. But scientific discovery and scientific research has advanced a lot in trying to prevent these kind of adversities when developing vaccines. So I think director of the program this evening, I'm going to pause here, and then I can take further questions after everyone has shared how they've experienced the vaccine, for example, and what's happening in Nelson Mandela Bay in our Gqeberha city. Thank you. And now I'm going to hand over to Dr. John Black.
Hi, good evening. Thank you for inviting me to talk about this incredibly important topic and how it's affected our lives. I think one thing about this virus is that it's humbled all of us. It's humbled us in so many ways, certainly from an academic or scientific or medical point of view. Every time we thought we had a handle on things, it's turned around and it's changed the game plan, and we've kept having to adapt. And I think we've learned a lot about the health system, about ourselves. I think we've all been challenged in ways that we would never have thought of a year ago. So, you know, in a way we have to reflect on the past to see what we've learned and how to apply that to the future. And I think this, for me, is one of the big lessons, is we need to look back at what's happened and remember this, because it's very important in terms of how we approach this vaccine and our attitude towards it. So perhaps I can reflect a little bit on the last year. We've had, certainly in Nelson Mandela Bay, we've had 2 waves of what can only be described as horrific numbers of infections. And certainly working at the field hospital where I was, at Livingstone Hospital, at Doringenza Hospital, all the hospitals within the metro, at some point we were entirely full. People were struggling to get into hospitals and we couldn't get people into ICU. Patients were dying, staff members have died, and I think it's been an incredibly difficult time, certainly from not just from a healthcare worker point of view, but from a population point of view. I think everyone has been personally touched or affected either by a colleague or a friend who's died or been very ill. And I don't want us to forget that, and I think it would be a tragedy to forget that. So the question really is, you know, where do we go from here? It's not as if with each wave we seem to be getting better. In fact, the second wave was worse than the first wave. And we weren't unaffected within the first wave. So in other words, this concept of trying to treat yourself out of an epidemic does not really hold much water. We have to find ways around it. So we can't just wait for wave after wave after wave and hope at the end of it we'll all be immune. I think the human cost and the human suffering attached to that is immense. So we really need to think about what we do. And I know the social and the psychological impact of these non-pharmaceutical interventions, the social distancing, the masks, the lack of being able to visit, what it's done to children in schools, and what it's done to elderly folk who are having to isolate, has been a really difficult process for people to manage. And really the only way to get out of this is to try and look at vaccinating people. Now, the vaccine in itself, there's a lot of controversy about it, and perhaps I can add on to what Dr. Ngwebi has been speaking about, because I think it's very important to understand how the COVID vaccine is, you know, how it's going to affect people and what impact it's going to have. Now, if perhaps I can take a step back and just remind you that COVID was not originally a human disease, COVID-19, and it got into a human population, and as such it has adapted under stress, and that stress is when you have a population where there's a lot of infection. You're going to find that the virus that can transmit from one person to another in the most effective way is the one that's going to be dominant. And this is what causes the mutations to come out. And this mutation that the virus develops, okay, is going to change it. And that mutation in the virus is the same thing that will attach to you as a human when you transmit it, which is within your throat, within your nose, within your eyes. Those areas, okay, are the same things that the immune system is going to recognize to be able to attack it, those antibodies that we spoke about. So those are going to attach to what we call these things called spike proteins. The spike is what attaches to your receptors, what enables you to get into it. It's the same thing that the antibody attacks. Now, unfortunately, as that spike protein adapts and changes to be able to become more transmissible, so in other words, to move from one human to another human, the antibodies are going to have to adapt with it, which means that you get these what we call variants. And unfortunately, Nelson Mandela Bay was one of the homes of the new variants, which is why we really initiated the second wave within the country. And there's been a lot of concern around the vaccine and this new variant. And I think it's very important that we understand that this is a natural process that happens with viruses. With HIV, it happens very rapidly, which is why we can't get a vaccine to HIV, and other things it happens very slowly. So a vaccine will work for many years. And what we need to understand here is that although the vaccine is very effective against the old virus to prevent disease in excess of 80 to 90% in most cases, there is still value in this vaccine against the new variant. And what it does, it allows the body, it gives the body a head start, basically. So it means that you've got some concept of what this COVID is. It might not have a perfect binding to that specific spike protein because it has mutated, but it allows the body to get on top of the infection and it stops severe disease. So that's very important if you think about what I was reflecting on, is everyone knows someone who's been severely affected by COVID. The hospitals have been overrun and they've been full. So while it might not in all cases prevent mild disease and transmission, it will hopefully prevent severe disease. And all the information that we've got available suggests that the current vaccine prevents severe disease. And in fact, there was some really good information coming out today about the J&J vaccine, suggesting that even with the variants, the impact on that is about a 64% reduction in mild to moderate disease. So it's good news. Okay, it does work specifically in preventing severe disease, and this is what is going to help us get through the third wave, the fourth wave, or whatever waves comes in terms of being able to stop people getting severely sick that they need to get into hospital. So I think that is would be my main message today in terms of understanding what the role of the vaccine is going forward. As I said, we can't treat ourselves out of this. And unfortunately, if a small percentage of the population get vaccinated, it will leave a large number of people who still get severe disease. And I can promise you, I've had the vaccine and I've had COVID personally. And I can tell you that the vaccine is nothing compared to COVID. Okay, the side effects which you'll hear about are very mild, and the potential benefits of this vaccine far outweigh any of the potential small related side effects that you will be able to exhibit. But on that note, to further discuss the rollout of the vaccine, I'm going to hand over to Mrs. Norche from Livingston Hospital.
Good afternoon, colleagues. Ladies and gentlemen, I greet you this evening. My name is Mrs. Tembisa Norche. I'm the nursing manager here in Livingston Tertiary Hospital. I must say that I am very delighted to be part of the solution at last. We've had a long time of pain, sorrow, and we didn't know that we will get to this day. But today we have at least a solution. As Livingstone Tertiary Hospital, we were one of the 2 facilities in Eastern Cape that has been designated as the vaccination centers for this period, which is called Early Assistance Program. And we form part of that program. We encourage and we try as much as we can, and we communicate that people must register, because for one to get the vaccine, you have to register on the electronic system called EVDS online. We register online, we assist each other. People that cannot go onto the system are being assisted as much as possible. It is an electronic vaccine data system that goes online for registration. It is the beginning of the journey to getting the vaccine. Because if you are not registered, there is no way that you can get the vaccine. There are steps that you follow when you register. You will receive an SMS after you have registered online, and the SMS will tell you, dear so-and-so, we have received your registration, and it will tell you that you will be contacted via SMS regarding the next step to be followed. That is the first message that you receive. After that, you receive a second message that will tell you that your registration has been approved. That is now the second message, and you will also be informed about the outcome. The second message comes with a link. You click on the link, and the link will take you to the few questionnaires that you have to answer, about 6 questions. And when you answer the questions, then you wait, and then you get the third SMS, which will come with a voucher. And when you receive a voucher, it will tell you to proceed to get the vaccination where you have selected to get the vaccination. And then it's followed by booking. Once you receive the voucher, you still have to book so that you are expected in the vaccination center. When you get to the vaccination center, the forms of bookings that we are having, we have got an online booking, which we have developed as Livingstone, being assisted by Nelson Mandela University. We have a booking system online that you will book the date that you want to come in, and then we will accommodate you according to what you have selected on the booking system. We have also made available a landline so that for a person that couldn't book online, you can phone us. There is a dedicated number that we are sharing with our healthcare workers. People can phone us and book, and then we get them in. We even go an extra mile of allowing people to walk in and book, because we try and open as much chances as possible so that everybody can get the booking. Now, we had to quantify the staff of Livingstone Hospital. We submitted the data that tells how many staff we have, and further to that, we had to categorize the staff, because as well as we are all healthcare workers, we are not all frontline workers in hospital. So we had to categorize the staff. We've got the category 1, which is the staff members who are working with the aerosolizing procedures that are patient-facing in critical units. And we have got staff that are working with the COVID patients. We have got staff that are working with the COVID non-confirmed patients, and we had to categorize. And in fact, in hospitals, we also have backline officers. So we had to accommodate the staff according to the areas they are working in. So if you are working as a frontline worker, if I can make an example, you are working in the emergency department or you are working in the critical care unit, you will be prioritized as a first priority. But obviously, if you are an officer working as a personal assistant or a clerk, you will be last on the priority, so that we prevent the overcrowding at the same time. It works perfectly. We are getting them according to those categories. Thereafter, a person gets to the vaccination center. And when you get to the vaccination center, you are being welcomed by a very friendly security officer who will allow you in, and you register that you have arrived, and you go to the screening desk, whereby you will be screened by a healthcare worker. After screening, you proceed to a special room that we have called it a pre-vaccination room, where we sort the healthcare workers before we vaccinate them, and we even go as far as checking their vital signs, so that if we pick up anything, we can quickly refer you. After that, we move you to the vaccinators. I have got about 29 vaccinators. We started off with 29 vaccinators, but we are working with our private sector colleagues. And so I also received some of the vaccinators from the private sector. So I ended up with 10 more vaccinators, but I roster them per day so that we do not overcrowd the center as well, which is also working very well. I do want to say we received, as Livingstone, about 3,218 vaccines. And amongst those vaccines, we had to put aside 30% for the private sector because we are working together. And if you count the 218, the 30% is about 965. So as we are working, we know that private sector has to get that 965, and the rest is for the public sector, which is also working very well. We're working together. And at the moment, if I may share with you, we are sitting at about 1,500 for the public sector, and we are sitting at about 400 for the private sector. So we are left with about 500 for the private sector and about 700 for the public sector. But I must say that we are getting there. We are doing about 400 per day. People are coming up and people are looking forward, and we encourage them to come. And then a person walks into the vaccinators room, and then she gets vaccinated. And when a person gets finished getting the vaccine, she moves over to a post-vaccination room where she is going to be observed for about 15 minutes before we discharge. And if we are happy with everything, we discharge the people. And if we are not happy, we refer. We have a roster of the doctor on call every day who is ready to come and assist if there is a problem. And I must say this far, we have not had problems in the center. Yes, we've had few reports that we got when people get back to their working units, but some of those are expected. We are doing very well, and we are looking forward for more. Thank you very much. That's all for now. I'm going to hand over to Masikole Bati, who is working here in Livingstone as a neophyte professional nurse. He's 35 years old, young gentleman. He's going to share his experiences with us. Thank you very much.
Greetings, everyone, in all their respective fields of work and study. It is an honor for me to be part of this conversation today. As Prof. Darrell was saying initially, that this conversation is vital because it aims at lifting the cloud of uncertainty to other staff members who have not been vaccinated and also to the general public. So mine is very easy. I am happy that I've been made part of this conversation. I was anxious initially, but as I have listened to the people who know more about the vaccine, at least that anxiety has now subsided a bit. I'm here to talk about my own personal experiences as far as the vaccine is concerned. I was vaccinated on Tuesday at the vaccination center here at Livingston Hospital, and all the other there are side effects that have been mentioned, but on my side is only the pain on the injection site, which has been finished now. It's no longer there. It is gone, and post the vaccine itself, I didn't feel anything other than the pain, which is usually what happens when someone gets an injection, because an injection is a foreign object. So if a foreign object is introduced into your body, it's like inflicting pain. So that is all that I can mention now. But there hasn't been any side effects like the fever or nausea or vomiting, nothing of the sort. I'm feeling the same way as I was feeling before I took the vaccine. And as Mrs. Noche Matron Noche has mentioned, that the vaccination process itself, it is as she explained. I got this card, which I hope everyone can. It's EVD. It has got my details and the EVDS vaccine number, which is the electronic vaccination data system vaccination number. So this number, it was explained to me that whenever there are any adverse effects after receiving the vaccine, you can go to your healthcare facility and then present this card. So I've listened to Dr. Mgwebi, and I understand that all that is done as far as this vaccine is concerned, people, nursing staff, and the general public shouldn't worry, because all this is research-based. There are people who are working tirelessly regarding this vaccine, in fact, fighting the pandemic. Even ourselves as frontline workers, we have witnessed the fatalities and the recoveries with regards to the COVID-19 ever since we have worked with it when we were employed for COVID. As Ms. Noche was mentioning, that I am a neophyte who just came into the nursing profession, and I came at a time of a pandemic, and as the majority of South Africans, the COVID-19 pandemic has affected me personally. So a majority of people in South Africa have been affected directly or indirectly affected by the COVID-19. I believe everyone, they have their own stories to tell, or experiences, let me put it that way, because stories may be another word that may not be acceptable. But they have been bad experiences. No one speaks about COVID-19 with a smiling face, unfortunately. And my experiences post the vaccine, today is day 2 after I have received the vaccine. And as I mentioned, the only thing that I can take out, which is negative, It's just the pain on the site of injection. Other than that, there hasn't been any adverse reaction. And if should there be any, I know that I can go to my nearest healthcare facility carrying my EVDS card, and then further steps will be taken. Because in all that has been mentioned by the speakers that have spoken before me, assist place if anyone feels that this vaccine is creating problems to them. Because what I have gathered, the information that I have gathered myself personally, as far as the vaccine is concerned, is that it aims to introduce the virus itself to your system, so that to your body, so that your body is not receiving when you are infected with the virus, it is not something that is foreign. You're put in our language that we speak, besides the one that is scientific. So your soldiers, which are your antibodies, will say that this is something that is not new, then we can fight it. Vaccine seeks to do to the system, as Dr. Ngweli was explaining. So I'm happy to be part of this conversation, and in my experience personally, I would like to say that people must go. I encourage them, and if they feel that there is any adverse, if they cannot tolerate, then they can visit their healthcare facility carrying their EVDS card, and then the people that are knowledgeable and that are trained, they will take it from there. I really thank you, thank Mrs. Moche for making me part of this conversation, and also I hope that by sharing my experiences, people will be encouraged, and in the process, I would have made a difference in this pandemic as well. Thank you very much.
Thank you so much to all the colleagues who've shared their experiences, and Masikole in particular. I think you have proved to us that to go for the vaccine, and also looking at Dr. Black with his beautiful background of the mountains and everything else, I think it's encouraging. It means that we're good to go on the vaccine. But we've been having very serious conversations and talking about the science behind the vaccines, the practical experience and everything else. But we thought maybe as part of our conversation tonight, we will introduce a special guest, and that is one of our very own journalists that we have in our midst in Gqeberha City, or the Nelson Mandela Bay area. We're still getting used to the Gqeberha bit. Who has done a lot of coverage in this time of COVID. So I would like to hand over for a moment to Estelle Ellis, who is representing the Daily Maverick, and give her the opportunity to say a few words before we continue. Estelle?
Thank you very much, Darrell. Yes, I'm more of a writer than a talker. So I checked my journals of a year ago, and it's quite hard to believe, but a year ago we had 0 positive cases of coronavirus. We were actually waiting sort of for the first one. Remember, we got these instructions in the morning from the boss: don't let the phone's battery die on you, because you might miss that call from Kize that there is now a case. And eventually I did miss the call because I was on a plane to Cape Town when it happened. But also maybe everyone can think back about the words that they didn't know a year ago. Our list that we suddenly had to learn included the wave, first wave, now we're on second wave, waiting for third wave, flattening the curve, which has become a very overused phrase, the wearing of masks. So it's hard to believe, but a year ago we were still going around without any masks. 70% hand sanitizer, and of course the big one, PPE, we still wrote it out a year ago. Now we're just using the abbreviation. SIU, and sadly, we also had to learn what that stands for. And it's been, I feel like I've aged about 10 years in this year of COVID. It's come very close to home for us. I've lost a lot of very close, good friends. I've had friends in hospital. My own sister was in ICU. And honestly, this is not something I will wish on anybody. I will take this vaccine in my eye if I have to. So I was happy to hear you can just take it in the arm. But I am so grateful for the work that was done for J&J to come here and assist our health workers. So it's been an interesting year. I think I'm currently working on a piece on the grief that we are all feeling. Everybody we've lost. I think at Livingstone Hospital there are a few well-known faces that are not there anymore. Our own Professor Lungile Papeta is not there, is not with us anymore. So I'm really feeling grateful that I get to report on this, and I really hope I do it justice. So for the questions that we're going to ask tonight, I went into our communities. I'm going to stand in a few lines at the shop and the clinic, sit down on a few pavements with people, and I asked them, what is it that you want to know about the vaccine? Darrell, and I don't know if it's okay, so I can ask the first question that almost everybody asked. Then we can maybe ask Matron Noche to help us with, is how big is the needle?
I welcome that question. The needle is very tiny. Actually, I'm fortunate to have a sample next to me. If I may just show you, it is the smallest of the needles that we use in hospital. It is, if I may even read the size of the needle, it is about 0.6 millimeters thick, and it is about 26 millimeters long. You can see. And it goes onto the thickness of your deltoid muscle on your inactive arm. Goes in there as much as your muscle can accommodate. Very little. It's just a little, not much, painful. So it is that tiny, the needle. So you can also associate it with the pain. It will not cause a lot of pain because of the size of the needle. So that is the size of the needle. Thank you very much.
Thank you, Mam Noche. That probably puts the minds of many people at ease, that it is quite a tiny needle. I want to, Estelle, just interject a little bit and jump to Masikole and ask him, he referred to the fact that the injection spot was a little bit sore. And yes, of course, you know, that is a common thing when you receive a vaccination, that there may be a little bit of tenderness. But Masikole, just how long did it take to get this jab? Was it a question of a few seconds, a minute or two that the needle was in your arm? Please share a little bit with us.
I also welcome that question. Thank you very much for that. The injection itself, it was less than a minute. It was less than a minute, less than 60 seconds, I would say. So it wasn't that long in terms of the duration.
Okay, that's very comforting. That's very comforting to know, Masikole. Thank you. So we can look forward to sitting down in the chair and having a quick jab and getting out there in no time. So it's not a prolonged process. I want to also just maybe ask Dr. Black Estelle, I know that you had some really interesting questions that may be of interest to Dr. Black to address. So if you wouldn't mind elaborating on one or two of those, please.
So, John, a lot of people are reading experiences that health workers who were vaccinated, they are sharing their experiences on social media with the headaches and maybe a slight fever and body chills. But there are a lot of people who fear that because the symptoms are so similar, that might mean that you now have the coronavirus if you had the vaccine, but it's almost like a weak coronavirus. But maybe you can just talk us through. I understand that that's not the truth, but then what is it that's causing these sort of side effects of the vaccine?
Yes, I mean, that's a very good question, and it's an understandable misconception that when you are injected with something that is supposed to provide immunity and you're told it's partly virus, and you do worry whether that virus is causing a problem. But as mentioned before, you are injecting a component of the virus, a very small part, which is just the spike protein, which is that little knob on the end which attaches. That cannot replicate, that cannot do anything. Now, the whole purpose of immunization is to create an immune response. And if you can imagine, any infection you get is generally associated with an immune response. And if you've ever had the cold, or you've had, any of these other infections, it's often associated with the symptom. Viral infections are very commonly associated with muscle ache and fever and headache and those sorts of symptoms. And that's exactly the type of symptom you can almost expect. Okay, some people get very mild symptoms. Other people get the myalgia, which is the muscle ache, the headache, and fever, which is very easy to treat with paracetamol. And within 24 hours, most people are back to normal again if they do get symptoms. Some people don't get symptoms at all. But this is a common side effect, and it's almost to be expected, because what it shows is that your immune system is actually doing its job. So it's a good thing that you're getting some symptoms, and it means that the vaccine is probably working. There is no way that the vaccine, by its nature, being a small particle of a component of the virus, will ever cause active infection. What is important is that before you go for your vaccine, if you do have COVID-like symptoms, that you should be tested in case you will be going into the center, you will be interacting with people. So it's, from a responsibility point of view, it's important to exclude COVID before you go, which is just looking at your symptoms and making sure you take the appropriate precautions. If you have a fever before your vaccine, that's more of a problem. But after your vaccine, you don't have to isolate. You just have to continue your normal precautions with social distancing, mask, and all the things you would do in a normal day.
Dr. Black, whilst we have you on camera now, there seem to be quite a few questions around the annual flu injections, and also linking to that, if you've had COVID, and you alluded to that earlier on, that you've had COVID, but yet you have received the vaccine. Would you please elaborate a little bit on that? Firstly, should the general public still go for their annual flu injection? And then also, if you've had COVID, what are the implications in terms of the vaccination?
Okay, so I think there are two components to that. So firstly, influenza is a completely separate virus. So I think it's very important that influenza vaccination is something that is fairly well accepted, and you do prevent influenza with the use of a vaccine. Again, the prevention is very much related to how well the vaccine matches the virus. And we generally take that once a year, but specifically in those high-risk people, but it's something that we encourage, and this has no effect on influenza vaccination at all. So you would do a normal influenza vaccination, and this should not in any way be related to that. In terms of previous COVID, the important thing with with this is we don't know specifically how long, if you've had previous COVID, how long your protection lasts and to what degree it protects against further COVID infections. In the same article that I read today looking at how good the J&J vaccine is, we've also had a report of about 4,000 people who were reinfected with COVID. What's encouraging is most of those reinfections weren't severe, but what we do know is your immunity does wane, which means that it gets less and less over time. And certainly, with the new variants, there are risks of further infection. So the recommendation is that even if you've had COVID, okay, the vaccination is there to boost your immune response, to try and prevent severe COVID. The risk of COVID in the first 3 months after you've had COVID is fairly low, but then the risk will go up with time. So if you've just had COVID last month, the benefit of the vaccine immediately now is probably a little less, but you will benefit from vaccine in the future. And maybe I can just maybe put to bed another concern is around, will we be having repeated vaccines? Because that fits in with this line of questioning as well. So, as mentioned before, the vaccine does mutate and your immunity does wane. Now, the vaccination companies, the people who are making this, are looking at each of these new variants. And similar to influenza, which mutates over time, and we look at that and we try and predict which is the new type of influenza that's coming. So every year we get an influenza vaccine that looks like from the Northern Hemisphere is going to come to us. We get vaccinated to deal with the change in the vaccine, the new variant to the influenza. We'll do the same with COVID most likely. So what we may find in the future, and as I say, every time we make a prediction about COVID, we tend to be wrong about it. But with this particular one, we know that with the variations, a repeat vaccination may be required in the future to try and both boost your immunity as it wanes with time and deal with potential new variations to the virus. So although I can't say it for certain, I will say that there's a good chance that you may require a vaccine in the future, and if you have had COVID, a vaccine is still of value.
Thank you for those insights, Dr. Black. I have quite a few questions coming through, and from the list that is still gathered when she went out onto the streets today, as well as some of the ones being posted in the Q&A. So I'm going to ask my colleague, Dr. Mkhwebi, to address two of the questions, and then I will pass on to Mamnoche thereafter. So, Dr. Mkhwebi, I think we still have a few people who are a little bit doubtful about this vaccination that they have to go for. So there are questions of what exactly do we find inside a vaccine? And then secondly, there are people who are asking, may they have a little bit of courage in the form of a liquid supplement before they go for the vaccine? So I think that maybe you could clarify a little bit of the science of how a vaccine is put together. And then while you are addressing that, I wanted Mamnoche to think about the whole issue around breastfeeding and whether it is safe for mothers to come whilst they're breastfeeding, etc., and whether they need to also declare specific things when coming for the vaccine. But Dr. Mkhwebi, I'm very interested to hear what you have to say about what one may take as a little bit of courage before coming for this.
Firstly, thanks, Darrell. Firstly, I think I just want to repeat what John has said about what is in the vaccine. It's an inactive. When I say inactive, it's a non-multiplying form of the virus. So when it's a part of the virus that won't be able to make the virus multiply inside you. So it's not live virus. So it is safe in that sense that you are not being injected with a live virus that will cause disease. So the scientists work such that you don't get live viruses, particularly with the Johnson & Johnson vaccine. It's an adenovirus that will not cause disease. You may get some mild side effects, as mentioned, that you get these manageable side effects. About taking a drink, I'm going to ask John, because I think the certain level of alcohol that becomes immunosuppressant. So you don't want to suppress your immune system because you don't know what kind of side effects you're gonna get. But John can elaborate further on that is from the clinical side. But personally, I would not encourage taking alcohol before, and certainly not even after you've had your vaccine. I know the couple of articles that I read about the Russian one, Sputnik, that they were warning people that do not drink after taking Sputnik because you are compromising yourself. But John, please, if I may, through you, Darrell, that John comments on the perhaps the actual doses or not at all.
Okay, well, I think we've learned a lot about alcohol and COVID in the lockdown for different reasons. Look, I think the issue around that is if you're talking about the fear of getting the injection and using alcohol as a way of developing courage look, I think hopefully what we're doing tonight is trying to reduce the fear of this and making it, taking the fear away from it so people don't feel the need to do that sort of thing. This is to be honest, we subject our children to vaccinations without any major concerns, and I think we just need to be a little bit brave about these things. Think about the consequence of not vaccinating, and I really wouldn't recommend going into social interactions, having been drinking, trying to get injections. From a social point of view, I think it's irresponsible as well as from a medical point of view. So I would certainly say, please don't go drinking before your vaccination. Sputnik in itself sounds like a bad form of Russian vodka. So, and also afterwards. Look, I think the best thing, go home, take a paracetamol if you're concerned about side effects and carry on. I think I want to leave it at that and would recommend that, for so many reasons, alcohol is not the best thing to take around vaccinations.
Thank you very much, John. So let's move from the one kind of drink to another. Mamnoche, I asked you about the breastfeeding. So could you maybe comment on the need for mothers to declare that they are breastfeeding and whether there is any impact of mothers who are breastfeeding in terms of receiving the vaccine?
Thank you very much, Prof. When you fill in the registration form, there's a lot of questions that ask anything that might be a problem. And if it allows you through, it means it is not an issue. According to the information I have, breastfeeding is fine. You can vaccinate with breastfeeding. We are a bit cautious with a pregnant woman. But as I said before, we have a full cover of doctors in the center. Anything that we are not sure about, we ask the doctors. Dr. Blake is there. We have our supportive staff health doctor, Dr. Khan. We have a doctor on call because we treat each case as unique. We do not take things for granted. We would always find out from a doctor if we must give or not, especially when a concern has been raised. So that's how we deal with the issues as they come. Thank you, Prof.
Thank you very much, Mamnoche. That makes us feel a little bit more comfortable about this. Estelle, I'm going to ask if you have one more burning question that you would like to pose before we go to our very active Q&A session as well. So, Estelle, over to you.
I think the last question from my side, doesn't really matter who answers it, but I think people were also a little bit confused because some have to get injections when they get them in the bum and some in the arm. And they were wondering, why is this specific injection given in the arm, or is it given in the bum in some instances, or must you just prepare for one in the arm?
So I'm going to give that one as a clinical answer to maybe to Dr. Black to respond to that.
I was hoping to avoid that question. First of all, it's socially a lot easier to get to the arm than the bum. Also, from an uptake point of view, you've got a lot less fat in the arm. You're injecting it into muscle, and your immune reaction to the particular vaccine is better in the arm than the bum. Often the injections that we give in the bum are things like anti-inflammatories and things that have a far, that we don't have to worry about the immune system and the way it works. So the effect of the vaccine is better when it's given in the arm into that specific tissue rather than the bum, where you're not quite sure what it's going into in terms of, is it fat, is it muscle, because bum's a lot more variable than arms are. So it's a more predictable response to the vaccine. So that's why we would normally give it in the arm.
Yeah. Can I add to that, Darrell? Yes. Also, I mean, from a cell point of view, in the muscle contains and it recruits immune cells that are called dendritic cells. So these are the cells that will take up that antigen very quickly and stick it to them on their surface like a little flag. So they're very efficient in doing that. So it makes sense to use a spot where there's more muscle.
Wow, guys, what an interesting amount of information, from Dutch courage to injections in the eye and the buttocks, and we've been all around town. I must say the conversation on the chat has been just as exciting. And one of the questions that I think we perhaps need to just touch on is, I know we've said that certain pregnant women and breastfeeding, we've addressed that, but there's a question, perhaps Dr. Black, if you could assist us. Which groups specifically should not vaccinate? And if somebody has a low platelet count, is that a reason not to take a vaccination?
Okay, so I think the issue around who shouldn't get vaccinated as a broad topic is important. Generally, the vaccines are very safe. There have been some reports of people having an allergic type reaction to some of the vaccines, specifically the Pfizer one was some of the early concerns. And the only major contraindication, what I mean by contraindication, those people who should definitely not get it, are those people who've had a previous allergic reaction to a vaccine. Okay, there's no peanuts and shellfish or anything from, in it. So people who have seafood allergies or food allergies, generally it's safe to take it. So only those who are allergic, known allergic to vaccines should not take this particular vaccine. Now, because it's fairly new technology in some of the cases, we don't know what the, and when they do the trials with the number of people, so looking at 4,000, 10,000, 50,000 people, they obviously don't put people in those trials who are profoundly immunosuppressed. So in other words, people on chemotherapy or long-term steroid therapy or with HIV, and then they don't generally put pregnant women in the trial. So when they've given the vaccine, the point is we just don't have enough data to say it's absolutely safe. Now, in immunosuppressed people, those people who, as I said, on chemotherapy, we try not to give live vaccines. So in other words, whether the virus has been, affected in such a way that it's still alive but not as strong as a normal virus, we tend not to give those to people immunosuppressed, but none of these viruses are live viruses. None of these vaccines are live viruses. So when you're dealing with someone who's pregnant or is immunosuppressed, then you need to just discuss with your doctor and say, what's the risk benefit of this? And then you can make a decision, but there's no reason to suspect that there would be any ill effect from the vaccine. And the efficacy of the vaccine, that's a discussion to have with your doctor when you're doing it. The slightly low platelet count is not an issue unless it's very low. We don't like injecting people with platelet counts that are very low, so that is an issue. But if it's above 50, we don't really have an issue with injecting for a vaccination in those ones. We've discussed breastfeeding, and then obviously the children issue is, should children be vaccinated? At this point, those clinical trials are still going. Children are at fairly low risk of severe disease. That's certainly not what we would call a priority population at this point. And I think when we get more information on that and when we vaccinated the more at-risk population, the issues around children will be addressed in the future.
Thanks, Dr. Black. Another burning question in the chat group has been surrounding the third wave. There's a lot of concern about whether it will happen and when are we expecting a third wave. I think if anybody on the panel would like to add something to that discussion. Dr. Black?
This is a question that I probably get asked the most. The crystal ball is fairly vacant on this. Everyone's got an opinion. Okay, we've been told, or predictions are that it may be in early winter, or May, June. Looking at the gap between the first and the second wave was about 20 weeks between the peaks. We're now at about 14 weeks since the last peak, but it all is determined by 2 or 3 major issues. Okay, the first issue is how quickly the virus is mutating. The second issue is how well people are behaving. And what I mean by behavior is what those non-pharmacological interventions are, which includes the wearing of masks, washing of hands, social distancing. And I know COVID fatigue is a huge problem. People are tired of COVID, they want to get back to normal life. But what is going to determine the size, the speed, and the magnitude of the third wave and when it happens is people's behavior, not anything related to, whether we all vaccinated or not. The fact that healthcare workers are being vaccinated makes absolutely no difference to when the wave's going to be. It just makes us feel better that we can hopefully be less sick when the wave comes. So I think the biggest message that we need to get out there is that the wave is likely to come, and the magnitude is determined purely by the behavior of the population at large in adhering to the simple things of mask wearing, of hand washing, of social distancing, and being responsible. Even if you get the vaccine, you should still continue to wear your mask. You should still continue to wash your hands. It is not a free ticket to go and behave in any way you feel like it, because there is still a risk, especially with the new variants, of getting mild disease and transmitting it regardless. So I think another big message must be continue to do all the things that we've been doing, and hopefully as we get more and more people vaccinated, the risk of that third wave will drop, or the fourth wave will drop, and the magnitude will drop. So at this point, it's a crystal ball, it's an open-ended thing. And it's very much in your hands as to whether it happens and when it happens.
Thank you so much, Dr. Black. I think that is a very important point to remember, that the development of a third wave is in our hands. We each have a role to play, whether it be large or small. And each of our roles is equally contributing to how safe the rest of us are. In the chat, we've also had a few other questions which I'd just like to just raise. One of them is, what is the biggest barrier to convincing people to take the vaccine? And I think it's lack of information and fear. And seminars and webinars like this and just sharing of information is the greatest weapon we have towards changing people's attitudes. And I would really like to say thank you to everybody who's participated tonight in helping change those attitudes. I must say other comments in the chat have been very positive. People have really enjoyed the session and the questions and the answers. And some of the questions I think that were asked in the chat were already part of the burning questions that Estelle has brought to us this evening. So I would like to then say thank you to all of our panelists this evening for giving us very, very deep and insightful answers in a way that I think is easy for everybody to understand. Sometimes when we are, as scientists and as healthcare workers, we are sometimes misunderstood, but I think that all of the information we've given this evening was very easy to understand. And I'd like to thank Nelson Mandela University for creating this opportunity and for facilitating this interaction, and for all of the lovely panelists for giving us their time this evening. On that note, I'd like to hand over to Prof. van Rhenen. Thank you.
Thank you very much, Dr. Thaver. And before I make some concluding remarks, I think I'll just do a quick round of the panelists and give each person an opportunity, maybe just to give a one-line closing remark. And Masikole, we've heard from you that you've taken the jab. If you were to advise any young person out there today whether they should take the vaccine or not, what would your advice be?
Oh, thank you, Prof, for that question. It is an opportunity for me to say that to them without any second thought, no hesitation. Go take the vaccine. Go, young people, because we are the spreaders of the coronavirus. We are sometimes we do not feel the symptoms. We do not get sick in any way, but in that we think that we are immune to the virus. It doesn't get into us, whereas we carry it, and it's been evidence-based, research-based, that we spread it through these clustered places that we and all the other places that we engage to, the places where we socialize. We get the virus, then we take it to our households. So it's either that if people are concerned about the vaccine itself, they must compare that with the fatalities that the vaccine brings about. So I think with that comparison, one would just go and take the vaccine, because in this period of knowing about the coronavirus, we have lost a lot of our loved ones, and personally, I have lost my mother. I work as a frontline worker. I do not know whether it is me or it is the people that she lives with, because unfortunately with the coronavirus, we cannot pinpoint as to who brought it. She might have had it at the mall or anywhere, but as I have said before, coronavirus affects everyone indirectly or directly. So going to take it, you are doing it for yourself and your loved ones. So I would encourage everyone to take the vaccine, to take the vaccine and make sure that you continue with wearing the mask, sanitize, because as I am listening to people who are experts in their field, it is that you may transfer the virus to people even if you have got the vaccine. So continue wearing the mask, sanitize and wash your hands, even though you have taken the vaccine. So mine is to say now, take the vaccine, do not hesitate. Thank you.
Thank you, Makole. So coming from that, we firstly express our condolences with your loss, but we also take the courage that you've expressed that people should go out and be vaccinated. Dr. Mkhwebi, I'm coming to you. One word from your side, what would that be?
One word from me is just to take, to pick up from what Masitole has said, that after you've taken the vaccine, just give your body some time to develop the immunity. And do not think that after vaccination, you can just live your best life and without a mask, without washing. I'm a cell biologist by training, so I always try to visualize what's happening in the body. So just give yourself time for your muscle cell to get your dendritic cells and present the antigen to your cells, so that, remember those T cells and the B cells I told you about. So when that flag comes, so you give a chance to the B cells to manufacture the antibody, and you give a chance to your T cells to multiply. So if you don't do that, you are compromising your immune system. So that would be my last word, that let's keep safe even post-vaccination.
Thank you for those words of wisdom. I'm going to ask Estelle, your last take on this matter.
Yes, I think I just want to say we are there for the public. We ask difficult questions on their behalf as the Free Press. I think you've heard tonight. I'll ask anybody anything. So engage with the journalists that are on the radar, and if you've got concerns, ask them to ask. I mean, that's the only, I always say you can ask anything, might be the other side might not answer, but it's not necessary in this day and age to sit alone and be scared because your questions haven't been answered.
Thank you, Estelle. Spoken like a true journalist, and Estelle makes sure that we all stay on our toes, and we thank you for that as well. It's an important role to play in society. Mam Noche, we come to you as the mother of wisdom here. Please share with us your final thoughts.
Thank you very much, Prof. Mine is to say, even if this vaccine had 1% efficacy, I wouldn't miss that opportunity. I would take it. Especially now, we are guaranteed 100% that you will not die. 100%, even if you get COVID, you will not die. We have got that guarantee. I don't think that I can lose an opportunity like that. To me, it's a golden opportunity. Especially, my mission has not been accomplished to serve the community of this metro that I love so much. I still need to live. Thank you very much, Prof.
Dr. Black, what says you?
I feel like I've had more than my minute on this talk. Look, a few short things. One, stay safe and keep responsible. Two, there's a lot of rubbish out there. Stay informed of what's going on. The fake media and the completely ridiculous statements that are made around the most ridiculous things. Please be informed and remember that this is about something that's much bigger than, a fake news story. I think you've got the opportunity to make a difference individually through safe behavior and vaccination. So please register for vaccines when it comes out. And if you get the opportunity, please take it and please remain safe and informed. That's it from me. Thank you.
Yeah, I think on that note, I think it was wonderful to have had this discussion with all of you. And the way to prevent the third wave remains simple. Wear a mask, sanitize, socially distance, and keep abreast of the news that's going around you. And when it comes time for you to register to vaccinate, please do. Thank you.
That brings us almost to the end, and I have the privilege of having the last word on this very important occasion. I would firstly like to extend a sincere word of thanks to the panelists who've given of their time to be here this evening. I know you are all very busy people with very important tasks. So we sincerely appreciate your time and also the knowledge that you've shared with us. And I secondly want to also thank the members of the public who have been participating in this webinar. The participation has been extraordinary. And I think this is the first of many of these conversations that we will still have in going forward. But let us not make it the last and ensure that we stay informed. I also want to just extend a word of thanks to the people in the background, the technical support and all the people. There's a lot that's happening in the background to make this happen. So thank you to all the people offering support as well. And then finally, I want to say there's been a lot of questions about people who've said that where can they watch this webinar again? It will be uploaded to the university's YouTube channel as well as our website. I want to remind you of our campaign that we've been running at the university since the start of COVID of It Is In Your Hands. Hashtag It's In Your Hands. Please, 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 when in doubt, visit the university's website. We do have a rich repository of information that we share. And when in doubt of questioning, you know where to find Estelle, or drop an email to any of the people who are part of this webinar. Nobody will say to you, there's a stupid question. We will only seek answers to your questions. With that, I want to say, please let us remind ourselves that COVID-19 is still very much with us. Even though the vaccine is here, COVID is still with us. You've heard Masikole say, wear your mask, Dr. Black, Mam Noche, Dr. Mkhwebi, Dr. Thaver, Estelle, everybody. Remember what we have said, human behavior is your best defense in tackling the virus. Ladies and gentlemen, we thank you for your time, for your attention, for joining us this evening. Please be safe and we'll meet soon again. Good night.